reports that when he is in a painful confrontation, he has learned to endure that confrontation by focusing on one point on the other person's body and keeping his eyes fixed at that point, and that way he's able to get through the confrontation. Another patient reports that she has no visual memory. If she looks at something and closes her eyes, she cannot remember what she has just seen. These are things that happen not in psychotic people, but in people who are walking around as if they're normal. The oral segment. We look for voice tone. We listen to people. Are they talking in a whine? Are they barking? Are their jaws tight? Do they have a problem biting? Do they have a problem sucking? Are they talkative so that they cannot keep their mouths shut? Can they cry fully? Can they scream? Can they yell fully? And finally, are they capable of gagging? Is there a problem in the throat and the oral segment that keeps them from maintaining a lively gag reflex?
What's gagging?
Vomiting.
How do you check that?
I'll tell you later. The cervical segment. Some people walk around with their shoulders held high and their neck held high, as if they are watching for where the next blow will come from. Where will the next danger come from? And they look like scarecrows in a field, with this neck always rigid and on the alert. And such people, if you ask them on the couch to just let their head fall and let gravity take their head, it is impossible. They cannot let their heads simply fall, because then God knows what danger might come in the interval. In the neck is also revealed stubbornness, haughtiness, trying to separate the head from the rest of the body, with a big long separation here. And problems in the cervical area also involve problems in deep crying, shouting, yelling, etc. The chest. The chest is one of the most significant areas for armoring, because the full expansion of breathing is involved in all emoting. In expressing anger, we go, if we are really fully angry. If we are passionately loving, we go, contrary-wise, in fear, we go, and we pull our chests in, which is why people with acute anxiety so often complain of a lump in the chest or a weight on the chest. When we cry, we move our chest fully in sobbing, so that in all emotional expression, the free movement of the chest is involved. Contrary-wise, when we want to inhibit any emotion, we hold our chests, which is why most of us walk around not breathing fully, because all of us are repressing something which we might feel fully if we let this go, which helps you now to understand the first patient that I described. Because when he was on the couch and for the first time he let his chest go, something arose from deeper in him which turned first into laughter. Almost invariably, if you just let that go on, that laughter turns into sobbing. But we didn't have time to do that in the first session. I didn't want it to happen in the first session. Also involved with the chest segment are the shoulders and the upper extremity. That's part of this segment. So that in the expression of the emotions that this segment is capable of, we have patients punch with all the anger that they can muster on the couch. I have a baseball bat, and they bang the bat on the couch. And we distinguish between those people who punch like this and those people who punch like that, because the second is what human beings should be capable of. And another expression of the upper extremities is to be capable of the feeling of longing, of being able to stretch out one's arms, longing for someone else or longing for contact with the universe, just to make connections. The diaphragmatic segment is used in all expulsive acts. The diaphragmatic segment is what we work on mostly in the expression of gagging, because that's where the gag reflex starts, from the contraction of the diaphragm. It's used in, obviously it's related to disgust, which means to disgorge what's in here, to get rid of it out there. The diaphragm and armoring of the diaphragm is geographically very close to the solar plexus, which is one of the most important of the plexi of the body, and to the heart, which is why when we feel emotions very deeply, we have a feeling in this area of our body, and why we talk so much in terms of heart feeling, because this is a very important area for deep emotional feeling. Consequently, when we succeed in loosening the diaphragmatic area, patients often experience a flowing of energy into their abdomen and pelvis, which they had not experienced before, and which they almost invariably first experience for a very short time as pleasurable, and then experience as anxiety-provoking. The abdominal segment has generally much simpler emotional functions. The educator A.S. Neal, the man who originated the Summerhill School, says that he used to divide his students into the tight bellies and the soft bellies. And the tight bellies were the children who were scared, who were insecure. And the soft bellies were the children with more security, who were able to move around more freely. I'll tell you one fascinating anecdote about currents into the abdominal area. One lady had succeeded in freeing her armoring through the diaphragmatic area and had experienced these pleasurable flows of energy in her abdomen. She came into her session the next week and she said, "Do I have something to show you?" And I said, "What?" So she opened her blouse, and there, halfway across her abdomen, starting halfway across, was a red rash. She said, "You see that? It says stop. It's a red light." The pelvic segment. When one begins to work on the pelvic armoring, one invariably encounters more anxiety than one had encountered up until that time throughout the whole rest of the therapy, because the pelvic